So questions on the treatment costing study? Take your time. You don't have to run to the mic.
Jill Gay, What Works for Women. And my question is, if you could go back to that last slide, what do you mean by comprehensive HIV treatment? That's sort of the key question. And let me elaborate on that just a second. So if I'm a woman living with HIV, does that include preconception counseling? So how can I get pregnant and with the most likelihood of reducing risk of transmission to my infant? Does it include counseling? Does it include what we call in the U.S. prevention for positives, which we've done very little of through PEPFAR? What exactly did you include as your definition for that?
So we use the same definition that PEPFAR does in its cost estimation, which is a range of services that go to delivering care to HIV-positive people. So that could be many different areas and include many different budget codes. I think the interesting thing with regards to women is how PEPFAR plans to include care for PMTCT as treatment as prevention scales up and B+ scales up, and how they would do cost estimation there and do projections for how those people would be included. We only looked at treatment in our scope, so the prevention areas were limited, but those lines are being increasingly blurred as the program evolves. So I think that's an interesting area.
Any other questions on the treatment costing? Going once? Going twice? Well, I will say that having a panel entirely of GAO means incredibly efficient speaker presentation. So we really appreciate that. You guys are awesome. So we're going to take just a little break now so everybody can get up and stand up and stop having to absorb information and chat a little bit. We have some coffee and tea. So we'll take just 15 minutes and people can chat, and then we'll come back and hear about 2 more reports, and then we'll talk.